So today I am discuss the topic diabetes mellitus. So first I discuss the definition of diabetes mellitus. What is diabetes mellitus? Diabetes mellitus, it is a metabolic disorder. Metabolic disorder. That is elevated blood glucose level in the blood. After that, then I am discussing the types of diabetes mellitus. First, these are two types. First type, type 1, independent, dependent, diabetes mellitus. After that, type 2, in this type 2, independent, diabetes mellitus. Then once more type of diabetes mellitus, it is gestational. Diabetes mellitus. So three types of diabetes mellitus. First type of diabetes mellitus, dependent diabetes mellitus. After that, type 2, dependent diabetes mellitus. After that, once more gestational diabetes mellitus. So first I discuss the type 1 diabetes mellitus. Type 1 diabetes dependent diabetes mellitus. In this types of diabetes mellitus, it is a destruction of pancreatic beta cells due to environmental factor, immunological factor and genetic factor. After that, I discuss the type 2 diabetes mellitus. Type 2 independent diabetes mellitus. Independent diabetes mellitus. Diabetes mellitus. So in this type of diabetes mellitus, type 2 independent diabetes mellitus is the destruction of sensitivity of the blood glucose level. After that, I discuss the causes of diabetes mellitus. In causes, these are many types of causes. The first cause is genetic factor. Then second, immunological factor. factor, after that environmental factor, intake of high sugar diet. After that emotional factor. So these are the causes of diabetes mellitus. Then sixth type, first independent, dependent, diabetes mellitus. Then type 2, independent diabetes mellitus. Once more cause, that is gestational diabetes mellitus. Diabetes mellitus. So after I discuss the pathophysiology of diabetes mellitus. Of diabetes mellitus. In pathophysiology, I am dividing the two part of the pathophysiology. First is type, first dependent diabetes mellitus, then diabetes mellitus. After that, second part of pathophysiology, type second independent diabetes mellitus. So in first type, first dependent diabetes mellitus, increase level of blood glucose. Then type second independent diabetes mellitus, decrease production of, decrease utilization of insulin. So that condition is arising after low level of glucose in blood. Then intake of decrease intake of insulin after that then decrease level of glucose in blood and type 2 independent diabetes mellitus hypoglycemia. So after that, decreased level of glucose in blood, that condition having diabetes mellitus. In type 2 independent diabetes mellitus having diabetes mellitus. So that is the pathophysiology of diabetes mellitus. After that, I discuss the clinical manifestations of diabetes mellitus. In clinical manifestations, of diabetes mellitus. First, polyuria, polydipsia, then polyphagia, after that fatigue, then weakness, wound, infection, pain in muscles, weakness, tiredness, so these are the clinical manifestations of diabetes mellitus. First is polyuria and second is polydipsia, then polyphagia, after that fatigue and weakness, wound, infection, pain muscle and tiredness. After that, I discuss the diagnostic evaluation. In diagnostic evaluation, first we are history collection, then physical examination, then sugar level test, then fourth, random sugar level test, fasting, sugar level test, So these are the diagnostic evaluation of diabetes mellitus. First is history collection, then physical examination, after that sugar level test, then random sugar level test, after that fasting sugar level test. After that I discuss the management of diabetes mellitus. So in management of diabetes mellitus, first we are giving the insulin therapy, then insulin pump, then insulin injections, and metformin, drugs also use, then diet, exercises, So these are the management of diabetes mellitus. First is insulin therapy, then insulin pump, insulin injection, after that metformin drugs, after that diet and exercises. So I summarize my topic. First is definition, after that I discuss the types. Type first dependent diabetes mellitus, after that type 2, in type 2 diabetes mellitus, independent diabetes mellitus, after that third one is gestational diabetes mellitus. Then after that I discuss the causes of diabetes mellitus, after that I discuss the pathophysiology of diabetes mellitus, then I discuss the clinical manifestations of diabetes mellitus, then I discuss the diagnostic evaluation of diabetes mellitus, then I discuss the management of diabetes mellitus. Thank you for watching.